2 months ago, the Nyakrom headworks was shut down. As at September 2025, turbidity levels had soared to 94,800 NTU, nearly 190 times the safe level. The closure left 10 districts in the central region without water. Today, health workers fear a looming outbreak of waterborne diseases.
At times we have to let them, instead of them to have a start dose here, we ask them to take it at home because there is no water.
Maureen Ejay Dansoa is the nurse in charge at the Nyakrom Chips compound in the Agona East District. These days, her hardest task is not treating the sick, it is finding water to keep the clinic running.
It's been very difficult. There is a nearby town, that's where we get our source of water. Because it's a borehole, it's free, but you have to pay for the motor, TNT. So actually they will take at least 20 cedis. So if you have 1 gallon, it means you are paying 1 gallon for 20 Ghana cedis. So it means if the person is going for maybe 2 or 3, more than 3 times, it means you are paying 60 Ghana cedis. And it's been very difficult. Yeah.
With the facility's borehole broken, Maureen must trek to nearby towns with gallons or pay motorcycle riders, draining her own salary to keep the clinic open.
Yes, from my own pockets. Yes, please, from my own pockets. Nobody is paying.
The entire Nyakrom community now depends on the Offa Pond, a dark, stagnant pool of water shared with animals. For hundreds of families, this pond is their only lifeline. Maureen fears that this same water, polluted and smelly, could soon turn their daily struggles into a full-blown health crisis. Already, she says cases are appearing.
Definitely, there is going to be an outbreak of cholera. After maybe the case has been resolved, there is going to be an outbreak of cholera. Yeah. And it has even started. I think last week we have diarrhea cases. Yeah. My back of sachet water is 8 cedis. They can't afford it. So the water they fetch from the streams and the bowl, that's what they have been taking. Yeah. So it's going to have a huge impact on after the case is being resolved. Yeah.
Well, chip compound. Osanke nsu ho. Obotu nsumaya esanke yesani nano nsu na say enti yensu oyarfo bi kra beda ho a yese ekoto pure water and as we say that man.
Oh, we can say we are pleading. We are pleading. At least if NGO or government, they should come to our aid.
Just a few kilometers away in Nyakrom, in the Agona West municipality, the story is no different. Here, residents now draw their water from the Accra River, dark tea colored, polluted, and contaminated by human activities.
I hide Nyakrom na ye depend. But this is na Galamsey for you. What sense no way tiffy. And just a Galamsey fight no. Why you want still Ghana water. And they no say eba say what the sikaba mo wa yinsu na. Eba fine. I'm still one jai o honti. They be an just a sika more a chinsu ye no mu. Nti aban na just o yire no ho say okutia Galamsey no way tiffy ho.
At the Nyakrom Health Center, senior physician assistant and head of the facility, Florence Mavis Odom, confronts the human cause of the water crisis. Her facility's borehole still runs, but the community's dependence on the polluted Accra River is now reflected in her case files.
Roughly in a month, we can say that about 10, 15, 20, depends. Yeah, once a while the typhoid, they report.
Florence warns that poor sanitation and unsafe water are making the people sick.
The water issue, because now the river, how it's being handled, You know, people go in, throw dust, rubbish and other things, dump rubbish, other pieces and other things. So I think last week, due to this, the assembly and then the municipal health directorate came around to distribute aquatap to purify the water that they use. It's not easy. We headed far, but today is just close to us and see what we are just facing today. So it still boils down to the government looking at it. If there are ways of getting rid of it totally, because I think people tried and they've lost their lives, but we still have to work at it, else Ghana will be in a great mess.
Health centers are surviving on sachet water, while communities drink from polluted rivers. In Nyakrom and Nyakrom, the fear of a full-blown health crisis grows more intense each day. Cholera, typhoid, and diarrhea are no longer distant threats. They are knocking at doors. If this is not an emergency, Mr. President, what is it? Emmanuel Jivenu, Joy News, Central Region.